Okay, I have the gown, cup, straw, liquid barium, and gas crystals for the esophagram. Now I'll go get the patient. Bailey?
Yes.
Hi, my name is Landon. I'll be assisting the radiologist in the esophagram today. Can you confirm your last name and date of birth for me?
April 6, 2006.
Okay, is there any chance of pregnancy? And then we're doing an esophagram today. Does that sound correct? All right, can you tell me what's been going on?
I've had some difficulty swallowing the past couple weeks.
Okay, is there any specific food that triggers it more?
Not really.
And then is there any time of day that you notice it?
Typically around the time I eat.
Okay. Have you ever had an esophagram before? Okay, so basically what's going to happen is we're going to get you set up on this table over here. I'm going to bring the radiologist in, and he's going to be doing a fluoro, which is just live x-ray. We're going to have you drink this liquid barium, which is just going to highlight your esophagus so he can better visualize it. And then if he wants to, he might also have you take these gas crystals, which is just going to expand your esophagus. It's going to make you feel like you have to burp, but we just ask that you try not to. And then after that, he'll let me know if there's any more views that he wants, but it shouldn't take too long, about a half an hour, 15 to 30 minutes. Okay? All right, before we begin, I'm going to have you change into this gown. I'll have you remove that necklace. And then are you wearing an underwire bra? All right. Then this gown can just go over your shirt. You don't have to take your shirt off for it. And it goes in, or it ties in the back, okay? And I can help you get that on if you need to. Your pants will be fine as well. So, yep, I'll just give that to you. And then you can let me know when you're ready.
Thank you.
All right. We'll come over here. I'll have you stand up on this thing. It's sturdy. You won't fall. All right. I'll just get this. This is all set up. So I'm just going to go and grab the radiologist, okay? Okay, Dr. Lenter, this is Bailey. We're doing an esophagram on her today. All right, Dr. Lenter is all done. He does want us to do 3 more x-rays just for some extra views. So we're going to go ahead and do those now, okay? I'm going to go ahead and move this out of the way here. Okay, and then I'm going to tilt your table back. You're not going to fall, but it might feel like you're going to. I'll get you a pillow here once you're laid back. Okay, I'll give you this pillow. All right, and then I'm just going to bring my x-ray machine over here. I'm going to lower your table just a bit. Okay, Bailey, we're going to do 3 x-rays here. For this first one, I'm centering 2 inches below the jugular notch with like 2 inches above the shoulder. I'm just going to feel around here. Okay, my light field is 17 by like 6.5. Okay, so I have light 2 inches above the shoulders, and I am centered 2 inches below the jugular notch. All right, Bailey. So what's going to happen here is I'm going to give you, or I'm going to set this cup of barium right by you. You're going to take 3 sips of it. And on that last sip, you're going to give me a thumbs up, and that's when I'm going to take the x-ray, okay? All right, I'll kind of move this pillow out of the way. I'll put this right by you. All right, so on that 3rd sip, just go ahead and give me a thumbs up, okay? Exposure. Okay, my technique for that was 5 at 95. Next, I will do the lateral. All right, Bailey, I'm gonna go ahead and have you roll up onto your right side for me, okay? I'll move this cup out of the way. Yep, and then your knees are just gonna be right on top of each other. Your arms are gonna be up like this, like you're praying. All right. Just gonna feel around here. My center is gonna be the same, 2 inches below the jugular notch with light on the mandible. A little bit here. Okay, Bailey, I'm gonna have you kind of scoot forward for me. Here we go. I'm just gonna make sure you're straight here. All right, my light field is the same, 16 or 17 by 7. All right, I'm gonna bring this cup back over to you. The same thing is gonna happen on that 3rd sip. I'm gonna have you give me a thumbs up. All right. Exposure. That technique was 12 at 95. Now I'll do the last image, which is an RAM. All right, I'll go ahead and take this. All right, for this next one, you're going to kind of lay on your stomach. I'm going to put this sponge right here. She's going to be angled at a 35 to 40 degree angle. I'm going to center 2 inches lateral to the elevated side, still 2 inches below the jugular notch in that general area. I want light. I'm up touching the mandible again. Okay, so I'm centered 2 inches lateral to the elevated side over here. There is light touching the mandible. My field size is still a 17 by 7. And then I'm marking the side down. All right, Bailey, the same thing. 3 more sips. Give me a thumbs up on that last one. Exposure, that technique was 8 at 95. On the AP, you see the barium-filled esophagus from the lower neck down to the stomach. For the lateral, you see the posterior ribs superimposed, as well as the vertebral bodies and the barium-filled esophagus. And then finally, for the RAO, you see the barium-filled esophagus between the vertebral body and the heart. All right, Bailey, we are all done. I'll take that from you. Before I get you off the table, I'm just going to give you some post-exam instructions. So we encourage you to drink a lot of fluid to get that barium out of your system. If you notice white stools, that is completely normal. If you don't have a bowel movement within 24 hours, call your doctor and let him know. And then we'll just get these images off to your doctor and they should have those results for you, okay? All right, I'll get you off of this table here. I'm just going to lower it. And then I will move that tube out of the way. We'll get you out of here, okay? right. Do you need help up?
I think
Okay.